Hello, good morning, viewers at home and around the world. We're happy to be back this morning. And on my right, I have Sylvester of Demo.
Doctor,
A very good morning to you. You're looking pretty with your lovely hairdo.
Thank you.
As
Doctor,
always.
As always.
Chief, good morning, sir.
Good morning, sir. How you doing, sir?
I'm fine, thank
How is
you.
the family, doctor?
Yes, so.
How the patients?
We thank God. I like your looks this morning.
It's God.
Yeah, thank you very much. Okay, so what we have today. Last week, we did mention that we are going to talk about meningitis today because of the outbreak of meningitis in some parts of the country. Okay, at the moment, a number of states have been affected, and of course, we need to know so that people can at least know a thing or two about meningitis. Okay, now, as an overview, I want to talk about what meningitis is all about. What is meningitis? Meningitis simply means the inflammation of the covering of the lining of the brain as well as the spinal cord. A disease condition that affects the lining of the brain as well as the spinal cord. That lining of the brain is referred to as meninges. So from the word meninges, inflammation that affects the meninges causes meningitis. And usually in medicine, when you hear any medical word that is ending with itis, it depicts a disease or an infective condition. Okay? So you have things like gastroenteritis, you have things like peritonitis, you have things like appendicitis. So if it has to do with, if it ends with itis, it's describing an infective condition. Okay? So meningitis is a disease or an infective condition that affects the meninges of the brain as well as the spinal cord. You can see before us the picture that is shown there. You can see, if you look closely, you can actually find that there's a thin line depicting the margins of the brain down to the spinal cord. And then you can see the picture on the left side, the circular one that was highlighted. You can see the inflamed meninges, and you can see the brain tissue. And you can also see the skull at the end of it all. Now, but this morning, I want to give us an overview of what we have from NCDC, Nigeria Center for Disease Control and Prevention, situation report. Now, this is as of January 24th, 2019. Key indications: total cases reported is 143. Total number of deaths by meningitis, 15. Confirmed cases, 11. Total samples tested, 60. Total samples collected, 70. States that have reported at least one suspected case are 13 states of the Federation. Okay? Now, I'll read out some of the highlights I have here. This is the CIS situation report for 2018-2019 season. The National Technical Working Group for Cerebrospinal Meningitis has been monitoring cases and ensuring preparedness and coordination of response across the states. States in the meningitis belt were formally placed on alert on the 8th of November 2018. At EPI Week 3, 2019, no new suspected case was reported. So you can see before us the diagram of states that have been affected so far. That's an updated map of the states that have been affected. Okay, now the states in yellow are actually the places where the meningitis have at least been reported. In at least each of those states have at least one confirmed case. Okay. Eleven samples were positive for bacterial meningitis, Neisseria Meningitis, serogroup C, accounted for 36.4%. 4 of the positive cases so far. So far, 15 deaths have been recorded among all suspected cases. In the last 4 weeks, EPE week 52, 2018 to EPE week 3, 2019, no local government area has been in the alert threshold. Media messages have been developed and disseminated via conventional and social media. The multi-agency CSM Emergency Operations Center, EOC, has been activated. Monitoring of situation continues across the high-risk states. Now, this morning, we'll be laying emphasis on meningococcal meningitis. Meningococcal meningitis.
Meaning what?
Like, is that
Meaning meningitis. Meningococcal from the organism that actually causes the disease.
Okay.
Now, meningococcal meningitis, I'm going to talk about some key facts about meningococcal meningitis from WHO, World Health Organization. Meningococcal meningitis is a bacterial form of meningitis, a serious infection of the thin lining that surrounds the brain and the spinal cord. Meningococcal meningitis is associated with high fatality rates. Up to 50% of people who pick up the infection, if it remains untreated, may not survive. Meningococcal meningitis has a worldwide distribution. It can occur in any part of the world. However, there's what we call meningitis belt in sub-Saharan Africa that stretches from Senegal in the west to Ethiopia in the east. And usually we have about 30,000 cases every year. In the neighborhood of about 30,000 cases are reported among these states, among these countries. And the countries affected are about 26. That's the countries that have the countries that have a high burden of meningococcal meningitis. Since 2010, and the rollout of meningococcal A conjugate vaccine through mass preventive immunization campaign in the meningitis belt, the proportion of A serogroups has declined dramatically, and that's a good news. Now, but before we narrow down to meningococcal meningitis, let's talk about meningitis generally. We have said at the beginning that meningitis is a disease condition, an inflammatory condition that affects the lining of the brain as well as the spinal cord, otherwise known as meninges. Now, there are types of meningitis, several types of meningitis.
Sorry, sir. Before we go to the types of meningitis, I want to get something clear. If person get meningitis, how he go dey do? Abi wetin go do am? Abi wetin only way they call symptoms? I don't know. Maybe I fast forward, but I want to have a clear picture of wetin we dey.
You know, for last that we treated last week, we talked say okay, person go diarrhea and all of that.
Yes,
That is,
yes.
we knew what to watch out for, what to
Yes.
look out for. So
See,
what are the symptoms that you're likely
meningitis?
to
See na wetin I
experience?
dey think for mind ni abi no be him, because when we dey small, meningitis na we dey call yirun.
That was what we thought. That was actually what.
Go twist.
Yes, you're correct. You're very correct, sir. Now, there are symptoms and signs of meningitis. But before we go there, before we go to signs and symptoms, I'll answer your question when we get there. But first, let's do a classification so that people can follow sequentially as well as systematically. Okay, so classification. We have the infectious meningitis as well as the non-infectious meningitis. Now, under the infectious meningitis, we have a number of infective causes of meningitis. Number one, the commonest cause of meningitis is viruses. Is virus or are viruses. The type of viruses are referred to as enteroviruses. Apart from virus, bacteria can equally cause meningitis. Fungal infection too. There's also fungal meningitis and there's also parasitic meningitis. These are among the infective causes. Okay, but the commonest in our environment is the bacterial meningitis, under which you have meningococcal meningitis. Now, the viral meningitis usually are self-limiting. With or without treatment, over a period of time, it will clear. With or without treatment, over a period of time, it will resolve. Okay, but that is not so for bacterial meningitis. Okay? Now, fungal meningitis is rare.
Okay.
Fungal meningitis is rare. Okay? It's not as common as viral meningitis and bacterial meningitis. And the presentation are somehow related,
Okay.
talking about the signs and symptoms of meningitis. Now, among the signs and symptoms of meningitis, I want to take it this way. The signs and symptoms that we can see in people who are 2 years and older, okay, and the signs and symptoms that we can see in people who are below this age group, okay. Among the signs and symptoms that we have for people who are 2 years and older, you have the major one is the stiff neck, which we talked about a while ago. Okay, so sometimes you discover that people who have such challenge will have neck stiffness.
Okay.
Another one is sensitivity to light. Okay, there could be high fever. There could be confusion. There could be lethargy. There could be seizures. There could be sleepiness or difficulty waking up. Okay, sometimes there could be skin rash, sometimes referred to as meningococcal meningitis rash. Okay, these are some of the symptoms that you can actually find in people who are 2 years and older. Okay, but in smaller age group, newborns and infants may show those signs. There could also be fever, constant crying, excessive sleepiness or irritability, poor feeding, of course, stiffness of the baby's neck and the body is also there, okay? But usually for newborns, there's usually a bulge that is located somewhere here.
Everybody they call it auje.
Yes. Okay, so we'll call that bulging fontanelle. Bulging fontanelle. So that could be a sign. It usually bulges. Okay. Now, if you have
Doctor, is it that when it becomes obvious, that's where there's a problem? Because I think every child comes with that.
every child comes with that,
Where
but
would it
when you
breathe?
have an infection, yes,
Okay.
it does make some movement. You're correct.
Yes.
But when a child has an infection that
Okay.
affects
It's
like
bolder.
meningitis, it gets to swell up. It bulges.
Okay.
It's
that
more
cause
prominent.
concern.
You know, for a child that is less than 2 years, it's difficult for a non-medical person to elicit these symptoms. Okay. What the parents can actually pick out is that the child has stopped feeding, is no longer active as it used to be, and there's also the presence of fever. The neck stiffness, they may not be able to detect that, but that can be picked up when the child presents in a hospital setting. Okay. Now, these are some of the signs and symptoms that you can have, okay, depending on the age of the patient. Now, permit me to also point out that meningitis is commoner in children as well as young adults. But we said at the beginning that it can affect virtually all age groups. Okay?
So, sir, before you move further, does it affect animals? Because I've seen fowl, most especially fowl as a species. I make I call them fowl as a typical example. I don't see fowl. We fowl you could
Twist
be
the
like
neck. It affects animal. Yes, it has been reported that it affects, and especially the fowl that you mentioned. Okay, but the ones that affects human, there is no animal reservoir for the meningitis that affect humans. It's actually from person to person.
Okay.
Not like what we
Animal
had.
is not a carrier.
No, animal is not a
At least
carrier.
for this
It's
one.
humans that are actually the carriers here now.
Okay.
without
But this
God.
one,
So this one does not involve rats or
The
mosquitoes.
animal
yeah.
kingdom.
So it's
we
usually
thank
from-
you.
no rodents.
Yes,
Thank
from
you.
persons to persons.
Animal kingdom.
Okay, and having mentioned that word, it would also be nice for me to point out that it's being said that about 1 to 10% of all people in the population are carriers for this meningitidis, this type of bacteria that usually have it in their throat. Okay, this type of bacteria that causes meningitis, meningococcal meningitis.
Having
Okay?
it in the truth, sir. Does that mean that one can have it there and it will not manifest the symptoms, or once it is there, it is bound to manifest?
When you say someone is a carrier, thank you for the question. The person carries it and the person does not manifest any symptoms. If the person begins to manifest symptoms, the person becomes a patient.
Yes.
Okay, so when you say someone is a carrier, it means the person has a potential to transfer it to people around him. But usually when you have it in the throat, it doesn't cause problem until it gets into the bloodstream and gets into the brain. Of course, you know the blood, the human blood circulates to all parts of the body, including the brain. Okay, so when it gets to the brain, that's when that's when it becomes a problem. Okay,
I will ask this question, and it might make me sound a little bit
no, go ahead, sir.
A medical baby. But I will ask.
Go ahead.
Does that mean that anybody carrying meningitis now, which is a carrier, like we've known most carriers?
No, not carrying meningitis per se. Carrying the bacteria, the organism.
I'm talking about meningococcal now.
Yes.
Anybody carrying meningococcal now, like many other carriers that we know, does that mean that the person too stands immune of that thing? Because we know most carriers are not affected.
Very good question. Now, we're talking about Neisseria Meningitidis here.
Okay.
That's the causative organism, the bacteria that causes meningococcal meningitis. Now, people who carry Neisseria meningitidis within their throat may not manifest with symptoms, but usually there could be challenges. The body system could have some challenges that can actually make them or predispose them to picking up the disease, especially when their immune system is suppressed. And that can be done when someone has cancer, HIV/AIDS, when somebody is on immunosuppressant drugs, for people who have had organ transplantation, or for somebody who has had his or her spleen removed by way of surgery. So this group of people are at risk of having this problem much more than the other people in the population, and we'll see a number of other things along that line.
I think we should open phone line, Doctor.
Yeah, at this stage, it will be nice for us to open the phone line so that viewers at home and around the world will have an opportunity to ask us questions, should there be any, and as well as make contribution. Okay, so the phone lines are displayed on our screen. Help us out. See most of them all.
Okay, guys. So, of course, 08105434981. Of course, 08173147589.
Thank you very much. Okay, so we're going to talk about bacterial meningitis. We're going to mention some of the causes, some of the organisms that can actually cause meningitis among this group of organisms. Number one, Streptococcus Pneumoniae. This bacteria, or this bacterium, is the most common cause of bacterial meningitis in infants, young children, and adults in the United States. It more commonly causes pneumonia or ear or sinus infection. A vaccine can help prevent this infection. Okay, now we will come to that. Now the next one is Neisseria Meningitidis, the meningococcal, the one that is responsible for meningococcal meningitis, which is actually what we are laying emphasis on today. Now, this bacterium, when it is one, is bacterium. When it is more than one, is bacteria. Okay, so this bacterium is another leading cause of bacterial meningitis. This bacteria commonly cause an upper respiratory tract infection, but can cause meningococcal meningitis when they enter the bloodstream. This is a highly contagious infection that affects mainly teenagers and young adults. It may cause local epidemics in college dormitories, boarding schools, and military bases. A vaccine can actually help to prevent this. Okay. Haemophilus influenza type B is another bacteria that causes meningitis. Okay?
Can that be from influenza fever?
Related, sir. Haemophilus influenza type B, HIV bacterium, was once the leading cause of bacterial meningitis in children, but new HIV vaccines have greatly reduced the number of cases of this type of meningitis. And then there's Listeria Monocytogenes. Listeria Monocytogenes causes listeria, okay, also meningitis. This bacteria can be found in unpasteurized cheeses, hot dogs, and lunch meals.
Really? Okay.
Pregnant women, newborns, older adults, and people with weakened immune systems are most susceptible to this type of meningitis. Listeria can cross placenta barrier, meaning that it can affect a baby that is inside the womb in a situation where a pregnant woman picks up the infection.
Automatically.
Of course, late in pregnancy, it can cause premature delivery, it can cause abortion, it can cause stillbirth when it affects a pregnant woman. Okay? Viral meningitis, we have mentioned that before. Viral meningitis is usually mild and often clears on its own. Most cases in the United States are caused by a group of viruses known as enteroviruses, which are most common in late summer and early fall. Those of you that travel will know more about that.
That is it, my brother. Thank you. But you see, that's why I like you. You reason in the right way. You see, those of us that we are fond of traveling, we know what difference between summer, winter, and snow.
But our environment is also usually seasonal. Talking about meningococcal meningitis, our own environment, the timing is usually from December to June, when we have harmattan seasons. Okay.
You people say this thing.
Yes, that's our own, our Nigerian setting,
African
setting.
African setting.
Okay,
doctor.
so
took me time before I could get you people's weather here.
yes, so viruses such as herpes simplex, mumps, West Nile virus, and others can also cause viral meningitis. So like we said, this usually will resolve on its own, not like the deadly meningococcal meningitis. Okay, so there's also chronic meningitis, usually caused by fungus. And there's also fungal meningitis. And then the other causes, other meningitis causes are the non-infectious causes. Okay? It can occur as a result of meningitis can also result from non-infectious causes such as chemical reactions, drug allergies, some types of cancer, and as well as some inflammatory diseases. Talking about a disease like sarcoidosis, okay, this can actually cause meningitis. Now, we go over to the risk factors. Now we are going to narrow down to meningococcal meningitis. We have talked about some other causes that there could be. Okay, so we are narrowing down to meningococcal meningitis.
Which is
Adewale from Ilori. Good morning.
Good morning, Adewale.
Yeah, good morning.
Yeah, good
morning,
morning,
sir.
my brother.
Yeah, well done.
Yeah, thank you.
Please, I have some questions to ask.
Yeah, please go ahead.
Okay, yeah, you said the virus is found in the throat of carriers. Does it mean kissing could cause transmission of this virus?
No, I didn't get that, sir.
I said you said the virus could be found in the throat of carriers.
No, the
Carriers.
bacteria, not the virus
Bacteria.
now. The bacteria.
Sorry, the
Yes.
bacteria
Yes, sir.
can be found in the throat. Yeah, does it mean kissing or engaging in kissing can facilitate transmission?
Yes,
Of the
perfectly
bacteria.
well, perfectly well. You're thinking ahead of time, sir. You're thinking ahead of us as well, okay? Because we are still going to talk about that when we get to transmission. But having said so, I also want to chip in a thing or two before we get there. Now, the transmission, like he pointed out, kissing can actually cause it, okay? Apart from kissing, it's actually caused by
Okay, you heard what he said, right?
release of respiratory droplets. A release of respiratory droplets, like somebody sneezing, somebody who have is sneezing or coughing
And
intensely.
touches your skin.
Yes, close to some other. Of course, when you say droplets, they are airborne. Okay, so if someone is around you, that is why it is very contagious, and that is why it affects mostly situations where you have overcrowding, like in military camp, crusade ground,
Hostels,
Hajj
hotels.
pilgrimage centers where you have people,
Markets.
football pitch, jamborees where you have people, even sometimes in the buses.
Yeah.
When we used to have back in the days when you
Yeah,
used
you
to
had
have
to-
mole,
yes, mole.
everywhere is jam packed. Okay, so when somebody sneezes or cough, that is why we usually advise if you're in any place and you're sneezing, before now we usually advise that use your handkerchief to cover your nose as much as possible, or use your hand. But that's no longer the advice today, because if you use your hand to sneeze and you're probably a passenger in Mole,
My old the stand.
before you get down
You
to have
always
your
touch
hands
somebody,
washed, there's
yes.
no way you could meet your friend along the line and pump hands.
Yeah.
And by the time you're doing so, the person you're checking you're checking his
Transfer
hands or
from
her
one
hands
person.
may not know that you
Yeah.
have passed across something. And it's common for some of us to pick our
Yeah,
noses
ew.
and our at all times. So you can easily be infected with stuff like that. So these days, when you want to cough, spare your hand, angulate your elbow, cough into your elbow. Okay, so that you can spare your hand, so that if you still see Slimity on the road, you can greet her without passing something across to her.
Abi, can you
Okay,
hear, Chief?
so yes, he is correct.
Very correct.
Kissing can actually be one of the ways through which this can be passed across from one person to the other. Okay. Now, the risk factors. Okay, what are the risk factors for meningitis infection? Number one is skipping vaccinations. Permit me to also say that there are several type of vaccinations covering different types of the serogroups. For instance, Meningococcal Meningitis or Neisseria Meningitis, which is actually the causative organism for Meningococcal meningitis, have 12 serotypes. Okay, but among these 12, only 6 are known to be very infective. Yes, that's the word. Are known to be very infective and can easily be transmitted from one person to the other. There are serotypes A, B, C, W, A, B, C, W, and XY. Okay, these are the serotypes that are common. Okay, and you have vaccines or vaccination that cover some of them. Okay, so when we get to vaccination, when we get to talk about prevention, we'll talk more on that.
Okay.
But skipping vaccination as one of the risk factors, when you don't get vaccinated, or when as a child, when you don't take your children to the hospital to get immunized, okay, you are exposing them to such risk.
Okay.
Now, permit me to also say that the vaccination does not confer a lifelong immunity like we have in some form of vaccination.
Yeah.
In this case, you need to do it. Some will last for just 3 years. Some others will last for just 5 years. So you need to redo them over and over again. But we'll talk more about that when we get to vaccination. Another risk factor is age. Age. We have said that most cases of viral meningitis occur in children younger than age 5. Bacterial meningitis is common in those under age 20. Okay, and of course, you know, secondary school children are usually, their age gap usually hovers at least almost always you have them under 20. Okay,
Yeah.
except people
It's
whose
like
bosses are somehow running late. Okay, or when you have adult education.
Adult education.
Okay, so age is a risk factor. Then living in a community setting, college students living in dormitories, personnel on military bases, and children in boarding schools and child care facilities are at greater risk of meningococcal meningitis. This is probably because the bacterium is spread by respiratory routes or routes and spreads quickly through large groups. Another risk factor is pregnancy. Pregnancy increases the risk of listeriosis, an infection caused by Listeria bacteria, which may also cause meningitis. Listeriosis increases the risk of miscarriage, stillbirth, and premature delivery. We've mentioned that before. Another risk factor is compromised immune system. AIDS, alcoholism, diabetes, use of immunosuppressant drugs, and other factors that affect your immune system also make you more susceptible to meningitis. Having your spleen removed also increases your risk. And anyone without spleen need to have regular vaccination. Okay? Now, we're going to talk about transmission.
Okay.
Okay? How are these transmitted? Okay? Okay, so Neisseria Meningitidis only infects human. We have said that before. There is no animal reservoir. There is no animal reservoir for Neisseria Meningitidis. Only humans are affected. Now, these bacteria, like we said before, are transmitted from person to person, okay? Through droplets of respiratory or throat secretions from
we have
carriers.
Fidelis. Doctor, you have Fidelis.
Okay, Fidelis from Rivers. Good morning, Fidelis.
Yeah, I'm from River State.
Good
Yes, sir.
morning.
I want to know the meaning of meningococcal
Meningitis.
Meningitis.
Okay, thank you very much.
Yes.
Now, the meningococcal meningitis, let me, at the beginning, we defined what meningitis is all about. It's an infection, it's an inflammatory condition that affects the lining of the brain and the spinal cord. Okay? When it is untreated, it causes death in 50% of cases. And even when people survive from it, they usually have some residual damage to some systems of their body. Some could have partial deafness, okay, when they survive it. But the meningococcal itself is referring to the causative organism, okay? So in which case, the meningococcal meningitis, the causative organism here is Neisseria Monocytogenes. Sorry about the words. They're sounding a lot medical this morning, but we are trying to simplify them as much as possible so that everybody can understand what we are talking about. Thank you very much for the question. Okay, so we have talked about respiratory droplets, secretions from carriers, smoking,
Everything.
close and prolonged contact, such as kissing, sneezing, or coughing on someone, or living in close quarters with a carrier, facilitates the spread of the disease. Transmission of N Meningitidis is facilitated during mass gatherings. We have said that before. The bacteria can be carried in the throat and sometimes overwhelms the body's defense system. And when that happens, the person can come down with the disease, allowing the bacteria to spread through the bloodstream to the brain. It is believed that 1 to 10% of the population carries N Meningitidis in their throat at any given time. However, the carriage rate may be higher than 10 to 25% in situations where we have epidemics. Okay, so ordinarily, where there are no epidemics, it's been said that 1 to 10% of the population, of the people in the population, are carriers of this disease. Okay, with the capacity of passing it across to other people around them. But in situations where we have epidemics, this carriage percentage is likely to shoot up to about 10 to 25%. Okay, we have talked about symptoms. The average incubation period for meningitis is usually for meningococcal meningitis. Okay, we have Timothy from Abia State. Good morning, Timothy.
Good morning, sir.
Good morning, sir.
Yeah, good morning.
Good morning.
Yes, the doctor is here. You can go ahead with your question.
Yes,
please.
and while you're doing that, can you quickly turn down the volume of your TV set, sir?
Good morning, my sister.
How are you doing, sir?
We can't hear you well,
We can't
Mr.
hear you
Timothy.
well.
Can you help us turn down the volume
on your
of your
TV
TV?
set.
I don't understand.
Okay, please go
with
ahead.
your question.
I only say we respect for the place for the conclusion of the lesson today.
Okay,
Okay,
thank you very much.
Thank you very much for the information.
I know it's the lowest level.
We can't even hear him.
We could barely hear you. We can't hear you, sir.
Can you hear me now?
Okay,
Yes.
better. What?
All right. Please, I want to this meningitis of thing. I have heard about it. Hello?
Yeah,
Hello,
go
well,
on.
we too.
All right. Please, can it cause any other thing apart from what you have said, something like headache or something of pains in the body or something like that? If it is, can you explain to me so that I can learn more about that thing of meningitis? Thank you very much.
Thank you very much, sir. The much I got is asking, can it cause any other things?
Maybe a
Outside what
severe
you
brain
mentioned.
damage,
Yes,
loss of
yes,
memory.
yes. It can actually cause a number of complications. There are a whole lot of complications that could occur as a result of this type of meningitis. I'll mention them. It could cause some of the complications. Number one, permanent brain damage can occur in people who survive it if it is untreated. Even when it is treated, it could still cause, in some people, it could cause deafness. In some people, it could cause acute renal failure. In some people, it could cause all sorts of complications, sometimes that will involve organ damage. That is when it's not treated. Okay? Thank you very much for the question.
Can it in any ways lead to impotency in a man? I ask because of the spinal cord issue.
As a matter of fact, can he paralyze someone?
Because most times we are made to understand that maybe our spinal cord is what helps us in reproducing, that maybe the semen flows through the brain through the spinal cord.
Thank you very much for that very important question. The spinal cord is okay. Let me correct an impression. It's not true that the semen flows. It's not that the semen flows through the spinal cord per se. Okay, but the whole concept of the physiology of erection in man has a lot to do with the spinal cord. It has to do with the complex interactions that involves the nerves, okay, that transmit this message from the spinal cord to the brain, and as well as the feedback. Okay, so it's a network of processes that will bring about, but majorly involving the spinal cord. Okay, so you're correct in that regard. But whether it will cause impotence, honestly, I do not have any material that I read that I can actually, yes, I can. So I can actually not say that it can cause impotence in man. Okay, I haven't read that. Okay, that's my question. But of course, anything that affects the spinal cord, if it is untreated, it can cause a lot of damage. Depending on the degree of damage or the level of damage, if the damage is at a certain level, it will give some certain symptoms. So it's just like steps. If you have, yes, it affects a particular step. For instance, someone who had a spinal cord injury, probably as a result of road traffic accident, if it involves a part lower down, the person can lose.
That was why I asked that if it can affect.
Yes, the person can lose the power of movement, the limbs. The person can have paralysis. The sphincters will give way, meaning that if the person sits, urine can be coming out easily. If the person sits, stool can be coming out. You won't be able to have control over these normal physiological processes in the body. Okay, so depending on the degree of the damage as well as the level of the damage.
So, sorry, doctor, this last question, I
Go ahead.
I know it's not, it doesn't have to do with meningitis, but I just want to learn. When a man is about to ejaculate now, there is this electric flow, there's this electric transmission that happens in a man. That thing, does it have any connection? Is it from the brain? That electric vibe we normally feel, where a man will be not.
You understand?
You will not. You will be.
I'm sure you understand.
Without using the word electrocuted for some minutes. Is it from the brain? If it's from the brain,
I'm a man, I'm not sure I've experienced this electricity that you're talking
No,
about.
I use the word electricity, but I use electricity, but I'm talking about that sensation. Maybe I should call it where a man is, that thing that we experience. Is it from the brain? Does it cause any brain damage, or it's natural?
No, it doesn't cause any. It doesn't cause any brain damage, so to say. But like I said before, anything that has to do with erection involves the brain. It's a complex interaction between the brain, the spinal cord, and other nerves that are connected. Okay, so that's why you have some of the causes of erectile dysfunction has to do with psychogenic causes, the causes that actually affect, that can actually come from the brain. Okay, when if you remember when we dealt with erectile dysfunction, yes, we talked so much along that line. But this morning, in order not to deviate from the topic of discussion, let's go back because we'll have a lot to say. Okay, so diagnosis. How is the diagnosis of meningococcal meningitis made? Of course, the diagnosis will start from the patient presents in the hospital setting. A doctor takes a medical history of this patient, which we refer to as clerking, ask a number of questions, and then ask about the vaccination history in such a patient. And after you have gotten all this, and as well as the presenting complaint, the next stage will be to do some form of investigation to actually find out what the person is having. Okay? Among the major investigation, among the simple investigation, not major now, but the most important one that one needs to do when you're suspecting that somebody may be having meningitis is that you need to do a lumbar puncture. you need to do a lumbar puncture.
puncture.
Yeah, you tap. Yeah, there's a space at the back, at the backbone, where usually we'll stick in a needle and take some fluid. You know, the spinal cord contains some fluid that we refer to as cerebrospinal fluid. Okay. Now, when you take this fluid, when you collect this fluid, it's usually, if it is purulent, that's an indication that this person may have. But it doesn't stop there. You have to send it to the lab where a culture can be done, and then under the microscope it can be looked at. If a culture is done, this organism can actually be cultured. Okay. Among other investigations that can be done is the common full blood count. You need to know, because if a child is presenting with a febrile illness, you need to rule out other causes of febrile illness in this environment. Of course, you need to rule out malaria. You need to rule out typhoid fever and or whatnot.
Dr. Batsa, like a particular caller of ours, we say they always talk saying get back pain. Can we say maybe maybe meningitis, maybe make it go for meningitis test?
No, because there are other associated symptoms. Thank you for the question. There are other associated symptoms that one needs to look out for. Number one of the most important symptoms that you should look out for as a doctor, if you're suspecting someone has meningitis, is neck stiffness. Almost always must have it there. In a child, it will also involve the body. Other than that, sensitivity to light is another one. Okay, so usually for us clinicians, we don't just start carrying out all manner of tests. We narrow them down based on the things, on the diagnosis that we have on the table.
Based on the clicking.
Yes, by the time you click, you have a number of diagnoses, you have your differentials as well. When you look at them, those will be your guide to as what investigation you may need to order for to actually help you to make, to get the diagnosis right, okay? So I've talked about lumbar puncture. If it shows a purulent spinal fluid, is an indication. The bacteria can sometimes be seen in microscopic examinations in the spinal fluid. The diagnosis is supported or confirmed by growing the bacteria from the specimens of spinal fluid or blood by agglutination tests or by polymerase chain reaction, PCR. The identification of the serogroups and susceptibility, that's sensitivity testing now to antibiotics, are important to define control measures. But I must sound a note of caution here. Sometimes if you're in a situation or an environment where you are unable to do the lumbar puncture, that shouldn't by any means delay the distance. Don't tell me our time is up. Okay, so we are going to continue from where we stopped today next week. So same time, and from us here, it's limited.
Yeah, doctor will continue next week.
Thank you very much, sir.
Yeah,
Thank you, sir.
Bye-bye.